I personally had a vaginal delivery, but it was a vaginal delivery with no pain. How did this happen? Especially when we know that Nurse Mercy Mary has a low threshold for pain and she was able to pull through with normal vaginal delivery. How did this happen? What really took place? Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for all my viewers. Today I'm going to be explaining how vaginal delivery can take place with no pain, how my anesthetics, how my midwife, how the doctors were able to manage my vaginal delivery with no pain. We all know that contractions come with regular pain back to back, especially when you are 10 cm dilated or 8 cm dilated. The contraction you get are back to back, and each contraction comes with serious pain. So in this video I'm going to be explaining what happened that made vaginal delivery take place with no pain. But before we go into details in today's class, if you are new on our YouTube channel, please click on the subscribe button, turn on the notification bell so you don't miss out. For all our returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today we're going to be talking about vaginal delivery with no pain. We all know in our local facility in Nigeria and in most African country, when you are contracting, when your baby is about to come out, labor is knocking at the door, they advise you not to take any pain relief because they believe the pain shows you that contraction is taking place, and that contraction gives you a clue on when to push. So you are not expected to take any pain relief at that particular moment, but you are expected to bear down this pain despite the whole situation. But here where I deliver, it was quite different from the usual. Let me tell you what happened. At the very beginning, I think 1 cm, 2 cm, I was in severe pain. Like I always tell you, my threshold for pain is very low. That I won't lie about. My threshold for pain is very low. So I was in severe pain. As at 1 cm, I was given morphine. Yes, not paracetamol. I was given morphine. So morphine actually helped me with the pain at that particular moment. But as time goes on, as the centimeter gets more and more dilated, the pain gets intense that morphine could no longer solve my pain problem. So they had to give me what is called a gas, Etonox gas. This gas, you have to inhale it during contraction. When contraction pains comes, you inhale it. You take a deep breath. So you are inhaling it. It helps you sort the pain problem at that particular moment during that contraction. It does not take away the pain, but it helps you reduce the pain. And it takes some seconds for that gas to work. That gas is made up of air and nitrous oxide. So what happens is that whenever the contraction comes, whenever the pain comes, you inhale that air. Yeah? You inhale as much as you can at that particular moment. To help you with the pain. So that was actually what I used for some particular time. But as time goes on, I became very weak that Etonox was not working again. So the next step was to get an epidural. It was to get what? It was to get an epidural. The epidural is given by an anesthetic. It's not given by your midwife. It's not just given by your obstetric and gynecologist. It's actually given by an anesthetic. So an anesthetic was informed. He came around and gave me the epidural. I know lots of people will be asking, what is epidural? How does epidural work? Epidural helped me terminate the pain totally. With epidural, there was not pain, but there was contraction. So I'm going to be explaining how it works. With epidural, what epidural does is to block the nerves, to block the nerve impulses. That's the nerve impulses responsible for pain, from the birth canal to the brain that transfer those impulses. It blocks it totally in such a way that you don't feel any pain. During that period. So I took epidural. I know a lot of people will be like, since you took epidural and there is no pain, how did you not know contraction is going on for you to push? It's as simple as that. What happens is that when it's time for the baby to come out, the midwife monitors your tummy. So what the midwife does is to place her hands on your tummy. When she places her hands on your tummy and she notices contraction has started, she tells you push, then you push. You are not feeling the pain. The midwife is there helping you to check for contractions. So when she tell you contraction is taking place, contraction has started, push, then you push. But we all know that back then is the contraction and the pain that gives us clue to push. But here the midwife placed her hand on the stomach and tells you when to push. So you push on the instruction of your midwife. You push on the instructions of your midwife. So with this epidural, depending on the type that your anesthetic gives you, depending on the movement you'll be able to make. But the type that was given to me, my legs were numb. Yes, my legs were numb. I could not move my legs. So I could only move my legs when someone helped me to move my leg. They helped me to lift my leg. So if I want to stay in a lithotomy position, I want to change position, my position change. We actually my position change actually takes place with the help of someone around. So just know epidural blocks the pain impulses from the birth canal to the brain in such a way that you don't feel any pain. And when using this epidural, the fetal heart of your baby is being monitored by a machine. Yes, the fetal heart of my baby was monitored from the very beginning of my labor till the ending when the baby comes out. So this monitor helps you with the heart rate of the baby. So when using an epidural, they ensure that the heart rate of the baby is measured. They ensure that the heart rate of the baby is taken into consideration to know if there's any effect on the baby. I know a lot of people will be wondering, what are the side effects associated with epidural? Something this good will usually have a lot of side effects. So I'm going to be telling you, it's not that bad. The side effects are not bad like it seems. The first is numbness of the leg. Like I earlier said, during my time, my legs were numb. So I was able to move my legs with the help of my midwife and those around me. And that particular numbness depends on the type of anesthetics, or depending on the type of the type of epidural that was given by the anesthetics, that will determine if your legs will be numb or not. But for me, my legs were numb and I needed someone to help me put my leg in the right position. For example, I had to place my leg in the lithotomy position, I had to place my leg in a particular position or change position. So I needed someone to help me do that because my legs were numb. Then the second side effect is that you have headache after the whole epidural process. Most people come down with headache, they start feeling headache after it, but it goes down, you get some painkillers and it goes away. Then the third side effect is that at that particular point where the epidural was placed, which is at the back, you are going to feel some soreness for some days, maybe a day or two, and it will go. Definitely you'll be given some painkillers after your delivery to help you with the pain down there, to help you with the pain if you are still in severe pain. So that will be sorted out by the pain killers. Then another one that takes place, the side effect that are likely going to pop up, is hypotension. Yes, hypotension simply means low fluid. Let's do it that way. Low blood pressure, low fluid in the body. So during epidural, they normally give a fluid. They give you some intravenous infusion that helps to prevent hypotension too. So these are the side effects. You can see that it is better for you not to feel pain than for you to avoid this. So if you know your threshold of pain is low and you like some vaginal delivery, I would advise you come to a conclusion to use epidural and also this ethanoous gas, because it actually helps me to manage my pain effectively well. So this is what I want to share with you, that vaginal delivery could be possible with no pain. All you have to do is to push under the instruction of your midwife, is to push under the instruction of your midwife as she places her hand on your tummy, and also make sure your baby is being monitored. The fetal heart of your baby is being monitored. There's something I like about the Western world in the sense that they take your pain into consideration. The pain is what a patient says it is. So they help you tackle your pain. They ensure that you don't feel pain. They want you to have a stress-free life with no pain. So they provide solutions to that particular pain in pregnancy for those that want to go through the normal vaginal delivery. So if it's because of the pain you are opting for CS, it is better for you to go for epidural if it's because of the pain. So because with epidural, you have lesser pain. You have no pain, you have no pain, because I was having no pain. All I just need to do, I needed strength to just keep pushing to bring the baby down with each contraction. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nonsense Mary saying thank you, bye, and see you in our next video. Hope this video is helpful.